स्कूल नहीं जाना है?
नहीं जाना है ना?
स्कूल जाना है?
क्यों नहीं जाना है बोलो?
अगर घर नहीं जाना है? क्यों?
क्यों मेरे साथ खेलना है इसलिए नहीं जाना ना, है ना? इसलिए रहोगे खेलने के लिए? ठीक है। तो डिस्चार्ज विदहोल्ड हो रहा है ड्यू टू excessive
refusal by patient.
refusal by patient refuse, सही बात।
Patient refuse discharge.
Hello everyone, I am Dr. RMD, Pediatric Resident at PGIMER Dr. RML Hospital, New Delhi. And with the previous introduction video, you would have realized what this video is about. This is about pediatric residency, the pros, the cons. The video is especially oriented towards new first years who are going to join pediatric residency. This is like an introduction and an orientation to them. So there are some bitter truths to start with, so let me start with the sad part and then go to the happy part. Okay, so first thing is pediatric residency is hectic. It is not like you get 9 to 4 job during residency. It is hectic, it is toxic also. In many places it is toxic. Okay, the good thing is the institute at which I am right now doing my residency, it is very less toxic. So that is one good thing that I have realized, that one good decision I have made in my life. Second, it is physically very exhausting, like you will be doing night duties and even simple procedures like a difficult cannulation. Okay, it will take around 1 hour sometimes. Okay, so it is physically exhausting. It is mentally torturing because you'll have to do many things. You have more responsibility, you have more accountability. It will be more emotionally draining also to see kids dying and all. You have to deal with parents, so it is emotionally draining. It is socially depriving. You won't have a separate social life, a personal life, especially in first year. But some institutes are fine, like mine institute, where I had a good amount of personal space also because of not much hectic working hours. It is stressful. Okay, there is no doubt in it. At times it becomes very stressful. And it needs to be precise, like for example cannulation and like for example central line insertion. Okay, these are minute procedures, even biopsies. These are very procedures done on very small kids, right? So it needs to be very precise, and all this comes with experience. Okay, patience is very mandatory. For example, when you put one peripheral line like PICC line and all, it will take sometimes 1 hour for the procedure. You won't get a proper vein, or sometimes some problems come ahead and then you have to change, you have to find a new vein. So it takes a lot of patience. Okay, a lot of patience is needed in pediatrics. Even for when you assess a child, like clinical assess a child, sometimes child will be crying. You can't directly examine a crying child. Okay, so you will have to wait for the child to be calm, then you have to apply some tricks, you have to show some toys and all. Okay, so then it is very responsible task, and alertness is always required. Even at night, 2 o'clock, maybe you are sleeping, or maybe you are not in a right alertful state, but then if nursing staff tells that there's like saturation is dropping, or the respiratory distress is there, or anything like that, or ECG is showing some abnormal waves, then you have to be very alert. Okay, so this alertness is also very mandatory, and you have to do multitasking, because when I go to ward in the morning, on one side I have to see the patients also, on one side I have to see what are the samplings that have gone, on other side I have to see what are imaging that is being done, on one side I have to make discharges also, and in the afternoon I have to go to OPD also. So you'll have to do multitasking in pediatrics. Okay, so that's why all this will be part and parcel of pediatric residency. And you can see me, some of my very sad faces, some of my like physically exhausted and mentally exhausted faces. Most of them are in first year and some of them are in second year also. So this is a common trend in pediatrics. Okay, so these are some of the very commonly asked questions to me being a pediatric resident. First thing is, will I be alone in ward and will there be alone duties? As far as central institutes are considered, no, you are not alone. Especially in RML hospital, first year is not allowed to do duty alone. Okay, so every time you will be accompanied by a senior resident or a senior PG. Okay, so individual duties will start from second year onwards. So but in many state colleges and all, maybe you'll have to do, but pediatrics is one branch where there will be more accountability and responsibility, so you won't be allowed alone anywhere. Okay, so you will be always guided. And who will teach you cannulation procedures like LP, procedures like central line or intubation. So don't worry regarding this. Seniors are always there and you are never alone. Okay, anytime you are alone, ask for help. Okay, so how to take history and what are the drug doses? For history, there is one platform called White Army, and under that they have a file called Pediatric Proforma. Okay, It has very good pediatric performance, and I use this even in my day-to-day ward basis also I use this. Okay, so you can use this as a pediatric performer to take history. And for drug doses, I'll tell in the next slide which are the books you have to use. Okay, and how much hectic can duty get? Sometimes it is like you will be waiting for the day to get over. Okay, it will be that hectic, and sometimes it will be very chill also. Okay, especially this trend I have noticed in Delhi. Whenever winters come, patient will be less. In extreme summer, patient will be less. But in between seasons like dengue season and all, it will get too much hectic. Okay, how to deal with toxicity? I had discussed this in my previous video. If you have not seen my previous video, just go and watch. In that video, I had discussed how to deal with toxicity and all. Okay, and this is the second part where we are discussing regarding pediatric residency. Before, in previous video, we had discussed about residency in general. Okay, next, can I go home during pediatric residency? Yes, it is possible. Okay, no one will deny you leave. And as far as I've seen for many pediatric residents all over India, you will be granted leaves. Okay, it's not like that. At least twice in a year you will be allowed to go home. And how to deal with 24-hour or 36-hour shifts? You will just get used to it. There is nothing specific in that. Okay, you will just get used to it. Next, this is one important question: what to carry in wards? And I have included this photo not to show my pediatric skills, okay, but to show that I carry this bag along with me. If you see this, okay, this is my carry bag, and in this bag I carry all the things that are necessary. I'll show you in the next slide what all is necessary. Okay, before that, what all are required? Scrubs and aprons is required, especially in emergency and ICU setting. You need scrubs. Okay, stethoscope. Many people ask me whether to buy a pediatric stethoscope or an adult stethoscope. Go for an adult stethoscope. Okay, pediatric stethoscope is not needed because you will be dealing from children from a neonate. You will be dealing till an 18-year-old. Okay, 17-year-old. In some institutes it's till 12. Okay, the efficacy of stethoscope depends on the surface area of the diaphragm. Okay, so if you are limited to a pediatric stethoscope, if you are a frank neonatologist, okay, then fine, a smaller diaphragm area is recommended. But then the Littmann stethoscope, no, the one which I have is Littmann 3B. Okay, that stethoscope has two surfaces. One is the bigger surface, okay, and the other is the diaphragm part, okay, at the behind. This has a greater surface area which you can use for big kids, and this one you can use for small kids. And also, especially in cardiac auscultation and all, you need two types of diaphragm also. Okay, so for low frequency and high frequency, so it is always advisable to go for this. Initially when I came, I had a very basic stethoscope of my internship which was for around 500 or 1000 rupees. After coming here, after my stipend came, I bought this steth. It was for around 10,000 rupees. I got on Amazon. Okay, so next is pulse ox. Pulse ox is very important, and I always suggest everyone, because I have experimented with various pulse oximeters, and the best one is of ChoiceMed company. Okay, ChoiceMed pediatric pulse ox. It comes in two colors, green and yellow. Green and orange, and it is the most reliable pulse oximeter I have seen so far. Okay, then what are the basic instruments you should carry in ward? I have told in the, I'll be discussing it in the next slide. Drug book is always required, that also I'll be telling in the next slide. A small pocket diary or pocket notes, always keep it, because whatever questions are asked in the ward or whatever doubts you have, you always note it down. Okay, so that you can go back to your room or hostel or home and then you can revise it. Then pens are very essential. Without pen, nothing is going to happen. And if you have, like what I do is, especially in winters where there is more chance of getting sick, I carry a kettle along with me, so that whenever I drink water, I just heat it and drink it. Okay, and ensure that you have access to good drinking water. Always carry 1 or 2 bottles with you. Then next very important question is iPad or laptop. What should we buy? Ideally what happens is, in pediatric residency you can't purchase so many books, so you need to have some source to read from as a notes. Okay, so always it is better to buy iPad or tab. Okay, I have a tab with me, and for this tab only I attached a wireless keyboard. So this is not much heavy as laptop, and it will be helping me in discharges also, to type discharges on keyboard, so it will be very easy to, okay. So I would suggest iPad or tab along with the keyboard. Okay, this will be a good combination. And what about charger? Okay, charger and power bank is necessary because you don't know when your duty is going to end. Okay, so anytime your mobile should be always charged. So these are some small things that you need to take care of. So this is my basic weapon set that I take to pediatric ward. So this is my stethoscope that I'm wearing right now also. It is Littmann 3B, okay, and classic, okay. And I use this rainbow color combination just for pediatric purpose, okay. And this is the measuring tape, which you should always have, okay. Measuring tape is always required. This is my stamp, okay, because in Central Institute stamp is very necessary. This is vein finder, okay. This blue thing whichever you are seeing now, this is a vein finder, okay. So this vein finder will actually, initially you would need help with vein finder, but as you become professional you won't need. So it will have this red light which will show you the veins on the surface, okay. So this was of Otica company, which I brought via Amazon, and it is working good for me, okay. This is tuning fork, especially if you are in pediatric neuro wards, okay. And this is the ChoiceMed company pulse ox that I was talking about, okay. This is the knee hammer, which is also as required, okay. This is pen torch, okay. This is pen torch, and this is toy which I carry always with me because it is pediatric wards. So what about the books? This is next important question which everyone asks me. So first year I would suggest don't go for any books, because first year is all about survival. I myself haven't studied much in first year because everything was about survival. Even though I had time also, I didn't go much to study, okay. Second, start with basics, okay. If you have time, go with basics, and the best book to start basics is this. This is OP Guy. It is UG book, but believe me, it is more helpful for PG than for UG, okay. So go with OP Guy for basic things. Like for example, you are seeing a case of acute hepatitis in ward, okay. So you want to know what is acute hepatitis, what is acute liver failure, what is coagulopathy, how is coagulopathy defined. For basic things, read this book. It is very good, OP Guy, okay. And even for exam purpose also, I feel OP Guy is one of the best book even for PG exams. Next, when you are posted in emergency, you need to know what are the emergency techniques. Like for example, a child comes with severe asthma, what are you supposed to do? Child comes with CHF, congestive heart failure, what you are supposed to do. So the best book for that what we use is AIIMS PSU protocols, okay. This is a thick book. I myself haven't read everything, okay, but then this is very useful for day-to-day practice. Third is, when you are posted in neonatology, what to read is this thing, AIIMS NICU protocols, okay, AIIMS NICU protocols. This is the standard book for neonatology. You can also use Cloherty, but I think AIIMS NICU protocols is more than enough. What about this one, the clinical methods, like you are in the ward. So what I use is this book, Piyush Gupta Clinical Methods, okay. So this Piyush Gupta Clinical Methods is very helpful for me. You can also use Aruchami also, that is also a good book. There are other books also, but I think these two are more than enough for PGs. One important thing is don't buy Nelson in first year, okay. Don't buy Nelson in first year, because one is edition will change, second you won't be adjusted with Nelson, you don't know if you will be adjusted or not. Read Nelson, it is good, okay. It is like a story, you will have, your base will be concrete and all. But for Indian setting, what I found is Piyush Gupta PG textbook is much better. So that's why I use Piyush Gupta PG textbook, okay. So this is Piyush Gupta PG textbook. This is volume 1, okay. So there are 2 more volumes, okay. So there are total 3 volumes, and I think Piyush Gupta PG textbook for an Indian student who is going to settle in India is much better compared to Nelson, okay, because Nelson has so many things. If you're planning for DM or if you're planning to go academically further, then Nelson is very essential, okay. And what about drug books? This is the Piyush Gupta drug book which I was talking about. This is very good because it has given drugs sequentially. Also there is one more, Meherban Singh also. This is also drug book. I initially had Meherban Singh, but then I switched on to Piyush Gupta because it was very handy and it was very easy to access the content in Piyush Gupta, okay. And what are the other sources? Okay, other main sources are PPTs or study materials. We mainly use PPTs and study materials from AIIMS and PGI Chandigarh, okay. So those also will be circulating online, so you can use them. Next, what I found the best source, okay, the best source for reference in wards is this IAP standard treatment guidelines. There is separate link for this, okay. There is Google Drive link also. It is also available online. Just in Google you go and search, for example, neonatal hypoglycemia, okay. Just search neonatal hypoglycemia and write IAP guidelines, okay. Just write this, you will get a PDF. There is PDF of IAP standard treatment guidelines for every disease, okay. So for almost all common scenarios there is IAP guidelines, so you can just refer that, and the like sequence that is given in that, it is given very concisely in 2 or 3 pages, and whatever the like the stepwise flowchart approach is given, it is very good, okay. So what I found in my second year, IAP standard treatment guidelines was the best source to learn from. Next, what about thesis? This is one more question. See, thesis always it starts maybe in 3rd or 4th month. For us, it started in around our 4th month, okay, as soon as we came to first year. So what you need to do initially is, you will be allotted a guide, okay. you'll be allotted a guide, and this guide and you will have to discuss regarding topic. So for us it was based on super specialty. My guide was a pediatric neurologist, so my thesis was on pediatric neurology. So I had to go and discuss regarding which topic I want to, and we'll have discussion, and then we came to a topic. My topic was SSP, subacute sclerosing panencephalitis, in a sample size of around 30 patients, and I had to see what is their micronutrient status. Okay, so this was my thesis. So I know SSP you people wouldn't have heard of, but here we are getting so many cases of SSP. Okay, so this was my thesis. Initially I had to make a protocol. Okay, protocol is a simple document which you need to present to the thesis committee, and after this protocol is accepted, your thesis will start. Protocol we had submitted by 4th month. Okay, 4th to 5th month we had submitted the protocol. Okay, and after that we had around 12 months of time, 12 months to 15 months. And in our second year, before our second year ended, we had submitted our thesis. So actual work of thesis is in last 2 or 3 months. In this 12 to 15 months you will be doing sample collection. Okay, after sample collection is done, then you will be processing it, you will be going you will be using statistician help, and then you will be getting the result, and then you will be publishing your thesis. Believe me, you shouldn't take tension for this. Okay, because all this will happen in a matter of time. You wouldn't even know what has happened. Like, I don't know how my thesis started also, I don't remember. I just did sample collection, and by the end, within last month, like 1, 2, 3 months, everything itself happened. It's like you don't have to take much tension. It will happen when your co-PGs and all are doing, you'll automatically start doing it. Okay, so you don't have to take tension regarding thesis. So I tell you right now, don't worry about thesis. Okay, it will happen as and when you go ahead. Okay, next, there are specific don'ts you shouldn't do at all, these things in residency. One is, don't overthink now itself, like what residency is going to be, how much hectic duty is, and what about seniors, what if they are toxic. So initial 1 or 2 months you will feel everyone is toxic only, because you won't, the main thing is you won't be knowing system, you won't be knowing people. Once you realize these 2 things, once you are adjusted with these 2 things, then it will become very easy. Once you get to know people, once you get to know your friends, once you get to know your seniors, and then once you get to know how ward works, how the system works, then it becomes easy for you. So there is no point in overthinking. Second, if you are panicking so much, then always ask for help. You are never alone in pediatrics. This is specific for pediatrics. In other departments, everything will be left on first year and senior will go away, but this will never happen in pediatrics. Okay, third, don't buy any app for NEET SS or INSS preparation, because it is not at all required. Okay, make your basics strong, read OPGI, read PICU protocols, read AIMS NICU protocol, go to the ward, see clinical methods. Okay, in 3rd year you can start preparation for all this, but not in 1st year, never in 1st year. Okay, next, procedures whenever you are doing, maybe sampling, cannulation, or maybe LP, whatever it is, always take utmost precautions so that you are safe, because you don't know what patients will present, especially in pediatric age group, like in HIV and all, you won't even know like child will be having, there will be no manifestations at all. So always take care of these things. And 5th one is personal protection is always mandatory, because in pediatric age group, patient will come walking and patient will have miliary TB. Patient will come walking and patient will have some form of abdominal cox. Okay, so you won't even know that patient is having TB. Okay, so always take precautions. It is very rampant. MDR TB is also very rampant, especially in Delhi colleges. Okay, so don't miss any outing or trips or parties or any conferences. Believe me, you might don't spend like whatever your work is, do it. Okay, but never miss out. Even if you're post duty, even if you are like working for 36 hours and then you are very tired, don't miss this thing. That is what I recommend. Okay, don't miss this thing, because you're not going to get the fun of residency without this. So going on to the happy part of the video, that is the pediatric residency hectic? Yes, it is hectic, it is stressful. At times you'll feel like, why you have chosen pediatrics, but is it worth it? I have been around 66%, I have been into 70% of my pediatric residency. Now I'm almost into 3rd year. So right now I feel it is worth it. Okay, so these are all my happy moments with in the wards, with the patients, in the ICU. Even you can see this image where I'm writing some things with my patients. So these are like some happy things which happen in pediatrics. Okay, and there are some academic achievements, also some academic entertainment that happens. This first image is from AIMS Delhi, where I won first place in genetics quiz. So this was when I got a prize from the HOD of AIMS, that is Dr. Madhulika ma'am. and this was these two images are from the IAP quizzes. So I was organizer also. I was helping in organizing IAP quiz for UGs, and I also won second place in college round IAP PG quiz also. And this was at American Academy of Pediatrics conference. So these are some conferences which I had been to in this last 2 years. And fun time in residency is always there. Okay, so this there will be parties, there will be freshers events. Okay, there will be farewell events. This was my birthday celebration in the ward, so this was outings and all. Okay, so it was fun time to be a part of pediatric resident here at RML hospital for last 2 years, and there are 10 more months to go. So I have had a very good time. So don't worry regarding whatever is going on in your mind right now, that it is hectic, toxic. Everything will be there. It is part and parcel. So at the end of 3 years, you will be feeling that this is worth it. It is totally worth it, and you will be a completely new person at the end of 3 years. Like, I was not so jovial 3 years ago. Once I entered into pediatrics, the patients itself will make you a kind of entertaining person. They will make you they will change your mindset, they will change your lifestyle also. So this is about pediatric residency, my experience in the last 2 years since I've been a pediatric resident. So welcome to all juniors who are going to take pediatrics this year. So let's hope for a very good future also. So those who are coming to RML, you are always welcome. So okay, so all the best for your residency. So thank you.